Well, there are so many reasons you should stay 5 feet away from people. You can't immediately identify who has the virus. And to reduce the spread of the virus, if you're already infected, and to also avoid contact with droplets from an infected person when they sneeze or cough. So it is therefore important to keep a distance of 2 meters away. That's about 5 feet from people, because you cannot identify who has the virus. It is called social distancing. We still have 2 confirmed cases of COVID-19 in Abia State. 2 patients, septuagenarian, 70 and 72 years old respectively, and have no previous history of travel, at least in the current recent past. Both patients had underlying medical conditions ranging from diabetes, high blood pressure, stroke and heart failure. They are presently at an isolation center and the Federal Medical Center Umuahia. Now this is Abia COVID-19 update. My name is Michael Oni. On this program, we highlight daily report of the Interministerial Committee on the Control of COVID-19, as well as Abia State Governor Okeze Pazu's efforts in ensuring that the state is safe from the virus. It is running simultaneously every weekday, from Mondays through Fridays, on several radio stations in the state. Live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We're also live on Bose 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Now let's take a look at the situation globally. The coronavirus is affecting 210 countries. More than 2.5 million people have been confirmed with the virus. More than 170,000 have died in the United States, accounting for about a quarter of all the deaths recorded. Well, over 45 people have died in the United States, and over 80,000 people have recovered out of the 800,000 confirmed cases. So that's the situation. But in Nigeria, the country recorded its highest daily figure since its first COVID-19 case in February. 117 cases were reported by the Nigeria Center for Disease Control yesterday. And of course, we have 2 confirmed cases, like I told you. And this morning, we're joined in the studio. We have the Deputy Governor of Abia State, Sir Udia Kochuku, joining us this morning on Abia State COVID-19 update. Good morning to you, Your Excellency.
Thank you very much for having me.
I'm glad to have you join us this morning. What is the update on the 2 index cases that we have in Abia State as of this morning?
Well, thank you very much. I think the important thing for us as Abians is for us to know and to recognize the fact that COVID-19 is here with us. I think that is the very, very significant thing. Because before now, some of us still feel that this is a fairy tale. These are things that happens in foreign countries, in other states. But today, we have 2 index cases. And before now, we've been talking to Abians, preaching to everybody to do everything to ensure that we don't have it in Abia State. That is by way of talking about preventive measures. But today, it is here with us in Abia State. And before now, as a government, we know that there is every likelihood that it will come to Abia State. So we have made every arrangement in terms of isolation centers, in terms of procurement of equipment and apparatus that are needed for the management of this case. And for us, for the 2 cases that we have in Abia State, for me is a little bit a serious cause for concern.
Okay.
Cause for concern in the sense that, just like you have rightly, analyzed, these are people that have, in the recent past, did not travel to anywhere. There's no history of recent travels of these 2 parties. And also, considering their age, and you then begin to ask yourself, where do these people get this
COVID-19
from? Is it from from their home. If it's from their home, surely it must be, it must have been transmitted to them by somebody. And who is that person? Is unknown to us.
So
that
the person is yet to be identified.
Yes, that person might still be in our midst, moving around, transmitting this COVID-19 to other people. On the other hand, there is also another school of thought. Who knows? Because going by the history, going by the report I got about these two patients, one of them had already spent about 16 days in the hospital. So, is there any likelihood that this person must have contracted this thing?
Which hospital is that?
Both of them were, from FMC. You understand? So, is there any likelihood that they might have contacted this thing from that place? And if that is the case, who must have done that? Is it a co-patient? Is it a medical doctor? Is it a nurse? So for us, it becomes a very serious cause for concern. But however, the important thing is that as a government, like yesterday, we have set out teams to go for
contact
tracing.
Okay.
From all the local government trying to locate, including doctors, personnel, and those people who are in the frontline officers who are managing these patients and all that.
We understand that there is a private clinic that got involved in this whole situation on ground right now in Abia State.
Yes.
What is the situation with that private clinic that was handling this one of the indexed cases we have in Abia State?
Well, His Excellency the Governor, in fact, yesterday instructed that hospital be closed down. And but you know that there is a protocol. You have a procedure for closing down a hospital, and that protocol must also be followed. I think because we are trying to do everything to ensure that we nip this thing on the board, so that it does not go beyond what we have already.
Okay. You mentioned that the index cases have no travel history. That leaves Abians in fears, I will say. But sir, we really want to have the situation report of how many of the contacts that have been identified from yesterday down to today.
No. The team are still doing their work. In fact, like I said, some of them, we have more than several of them, because going by the movement of the two patients, one is from Okwa West, so we have to send people to Okwa West local government, and the other one is from Iguano and Iguano local government, but he resides in Umuahia North. Do you understand? So
yes,
we have to send all those teams, both to where he comes from in Iguano and where he resides in Umuahia North.
Interesting.
And also the medical officers that are involved, nurses, the doctors, and all those who are involved in the management and treatment of these people. So you also send a team to them, including the hospital you talked about. We have also, teams have also been sent to those people, so that we'll be able to see how much we can be able to gather as those people who had contact with these people as possible, so that we'll be able to see what we can do to manage the situation.
Okay, Your Excellency, let's take a look at some of the policies put in place by the Abia State government to checkmate the spread of this virus in Abia State. The borders and also the face masks in Abia State. What is the situation? Are the borders still locked? And of course, it was also released that you cannot be on the streets of Abia without your face mask on. We want to know the level of compliance to that particular policy statement by the government.
Yeah, for the borders are still locked. And very recently we had information that some people, maybe some of the officers who are there are, compromising. And that we are yet to actually confirm. But we continue to plead to everybody, all the officers who are at the border posts, including the security agencies and those of our own members, employees of the Homeland Security, that this is a matter of life and death. If it is not you today, it might be you tomorrow. If it is not you tomorrow, it might be your brother or your relation, your friend. Whatever we can do to protect the shores of our state, let's do it for Christ's sake. So, to answer your question, is still under lock, because we also believe if we are able to protect our borders and we don't have people who carry this disease, who carry this virus from other states into our state, that will be able to minimize the chain of transfer, chain of transmission. So that is that. Then the issue of face mask. There is an instruction, order, or law in Abia State that if you want to step out, go to anywhere, you must wear your face mask. Why face mask? Just like the protocol states, once you're able to cover your face, your mouth, your nose, you can be sure that any droplets coming from anybody,
an infected person,
might not be able to have access to you. And that for you to actually get this thing right, continue to assume that everybody outside yourself is a carrier. So you should try to do everything to make sure that you protect yourself. So you don't assume that the next person is free, so I can go close to him, I can hug him, I can speak to him, I can. Please ensure that you wear your face mask.
Okay. Well, if you've just joined us, this is Abia COVID-19 update, and it is live on several radio stations. I'm going to reel these stations out very soon, but we'll need to go for a break now. We still have His Excellency, the Deputy Governor of Abia State, Udio Kochuku, right here in the studio. We go for a break, and when we return, we open the phone lines. Put your questions together and get ready to ask the Deputy Governor your questions.
At Flow 94.9 FM, we've got conducive and well-secured environment for business. High-tech video studio, a state-of-the-art production studio. You can also listen live on www.flow949fm.com and watch our videos on YouTube at Flow FM TV. Flow 94.9 FM, not just radio, but a complete broadcasting house.
Well, it is still Abia State COVID-19 update live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Bose 89.7 FM, Real 99.1 FM, all in Abia State, the Godson State. And we still have here His Excellency, the Deputy Governor of Abia State, Sir Udio Kochuku. And of course, we're opening the phone lines now for your questions. The numbers are 0808 182 6949 or 0811 605 2949. Hello, morning to you.
Yeah, good morning, Michael.
Good morning to you.
Good morning, Your Excellency.
Good morning, my brother.
Yeah, it's Alvan. I'm calling you from Bend.
Go on, please.
I must commend the Abia State government, ably led by Governor Victor Okezie-Ikpeazu. He has shown great qualities of a good leader, leading by example. He has walked around the clock to ensure that this thing didn't even enter in the first place. Now it is here. We will continue to appeal to our people, those that are still in doubt whether this is, because this morning I heard from some of the radio station people thinking that this is all politics. How would you say such a thing when you see what is happening even at FMC? You know, the people, these are the people who continue to deceive people, not to believe that this is real. This is real for crying out loud. If we will do what government have asked us to do, it's our own life. We are not doing this thing for government. It's very, very difficult. Michael, I just heard you some minutes ago talking about the economic effect.
Yes, quickly wrap up your thoughts for others to contribute.
Help ourselves to come out of this, difficult time. Thank you very much, Michael.
Okay, thank you very much. Good morning to you. We lost. That's 0808 182 6949. 0811 605 2949. Morning to you. Kindly move away from your radio set. Good morning.
Good morning.
Good morning to you. What's your name?
My name is Gift.
Okay, Gift. Go on.
I want to talk about the face mask. It's good. And also the two people suspected cases. So I pray that God Almighty will heal them in Jesus' name.
Amen. Thank you, Gift. Good morning to you.
Hello.
Good morning.
Good morning.
What's your name?
Hello?
Yes, I can hear you loud and clear. What's your name?
Yeah, this is Jetro.
Okay, go on with your
Hello?
question. Go on. I can hear you loud and clear.
Yeah, there is nothing like COVID-19 and Omaya. They want to use it and make money. There is nothing like that. They are not thinking yourself over there. There's nothing like that. Let them go to hell.
I will not allow such comment here. It's very important. You have the right to believe whatever you want to believe, but I need to let you know that you should stay safe for your life. Your Excellency, we still have some persons on the street, like the last caller, saying it is not real. What's your message?
That's the problem that we have. You see, I don't know what somebody will be benefiting by coming up to tell people that something exists when it does not exist, especially when people that you have trusted, people that you have, given the authority to govern you, are telling you, see, this thing is real, this thing is real. All we're trying to say is that, please, my brother, this thing is real. It is here with us. Do everything to ensure that you protect yourself and protect others. Because when you still carry on with the impression that it does not exist, and if by accident you are infected, you will still be assuming that it does not exist, and you will be everywhere transferring it to other people who probably believe that it does exist. So please, do those things that government and NCDC have instructed you to do by maintaining basic hygiene. Wash your hands. Ensure that you don't touch your mouth, you don't touch your nose, you don't touch your eyes, and also ensure that you wear face mask, and also observe social distancing. That is just the only way you can help us and help the government of the day. Like my brother rightly also observed, this thing has affected everybody world over. It has affected virtually everything about us, our economy and everything. And how can somebody be playing with issues that is also affecting your daily living? No, nothing is happening again.
I think I should direct the question this way, Your Excellency.
Okay, go ahead.
Because the belief out there is that the state government, forged the names of the persons and also wants the state to be on the list of the cases, the states that have cases of coronavirus, so that you can get your own share of the money. So are you getting any money? Is the state getting any fund from the federal government for having a case of coronavirus?
Thank you very much, my brother. As we speak today, the states have not gotten any dime from the federal government. Neither have we gotten any dime from any international organization, because these are things that people assume or think. And of what use? How much money would you even get as a state that you can compare to even how much we are even expending to ensure that we prevent this particular pandemic from entering into Abia State? So anybody that is talking about people want to use it to get money, how much? Where is the money coming from? If the money belongs to Nigeria, why not the Nigerians can also, the federal government can also share the money to all the states without even having this or having to tell lies about this pandemic. So it's I think anybody that is thinking that way is not just only doing himself a great deal of disfavor, but also to us as a people and to us as a state.
Hello, good morning to you.
Hello?
Yes, morning to you.
Good morning. This is Patrick.
You're welcome, Patrick. Where are you calling from?
I'm coming from Abia State.
Okay, you're welcome.
I just want to talk about the COVID-19 issue I'm hearing over here.
Yes, go on.
Hello? Can you hear me?
I can hear you. We can hear you here loud and clear. Go on, please.
The people that they are talking about that carry the COVID-19, which state are they from?
Okay, is that your question?
And which local government are they from? That's my question.
All right, thank you very much, Patrick. Your Excellency,
Yes.
where are they from? Those that are confirmed here in Abia State, and which local government?
Yeah, like I said before, two of them, they are from this state. One is from Okwa West local government area, and the other one comes from Iguano local government, but reside in Umuahia North.
Okay, that answers it. Some persons are already scared of going to the Federal Medical Center to access health care. Please, can you tell us the real situation, whether there is connection between the doctor that died and the index case?
No, from the report that we're getting from FMC, I don't think
Okay.
there is any link, any connection between the doctor that died and the index cases.
Okay.
And anybody that is also talking about being scared about FMC, I know that yes, if the patient did not stay in all the wards, so they were in a particular ward, and that ward, I think they have taken all necessary precautions,
Professional
trying
measures.
to ensure that they decontaminate that ward and make it safe for people to operate in that ward. So that is that.
Hello, morning to you. Good morning.
Hello, good morning.
Good morning to you.
Good morning, Michael. This is Joy. I'm coming from Ghana.
You're welcome.
Good morning, Mr. Governor.
Good morning, my
So,
sister.
Mr. I want to know, news was that there is no recent record of travel of this person. Then, my question is, then how did you get into Abia State? That means it has been existing here and we did not know. Because, okay, the agents that you say that were placed at the borders,
Okay.
I think I did trustworthy because every day I keep seeing that the street for.
Okay,
And around
we got the
the
question
city.
correctly, Joy. I will let you go because of the time. Thank you very much. How they got it, since they had no travel history?
You see, like that was the first thing I said. I
Of
think that
course.
is just what makes us get so much worried about this particular case. There is every likelihood. There are so many ways that they probably it's either one of their relations or somebody like that. Anybody within around them that must have contacted it and came in contact with them, or it could be as a result of several ways. So, but the important thing is that they don't have recent travel history. So the implication is that somebody within Abia State must have transmitted this thing to these people.
Which
And that
means
is the more reason why we should, each and every one of us, should be very, very careful and adhere strictly to the protocols, to the orders by government and health officials.
All right.
Because for us, prevention is better than cure. That is just the only way. Try to do everything to ensure that you prevent it from coming to you. Because as it stands today, we don't have any vaccine, neither do we have any drug that cures it.
Your Excellency, I want to really appreciate you and also appreciate you for the time spent on the program today. Abia State COVID-19 update. Your Excellency, the Deputy Governor of Abia State, Sir Udia Kochuku, thank you very much.
Thank you. It's my pleasure.
And many thanks to the partner stations talking about BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Bose 89.7 FM, Real 99.1 FM. The program returns on Thursday. That will be the 4th edition for the week. My name is Michael Oni. It is very important that you stay safe and take responsibility.